พี่โดโดสวัสดีครับ
สวัสดีครับมาครับพร้อมนะ
พร้อมครับ
โอเคทีนี้มาดูเลย alright so for today class we have to cover the four questions here right okay I'm going to start with the first question for this slide the first question is that should doctors be permitted to treat a human subject right with untested or even inadequately tested drug when there is I'm sorry when there are no alternative effective treatments and the patient prognosis is poor. Okay, so basically for this question I think you have to explain a bit the significant or importance of test drug or even untested drug, right? Okay, oh,
yes.
so let's say like you have to emphasize on the test drug is important in what way, and if there is no alternative effective treatment here, it means that, for example, like you can mention about COVID-19, right? Just because we have to inject such a vaccine, it's not that likely to be a treatment, but I can say that it's all about for prevention, right? But anyway, it doesn't mean that it's test adequately much, but we have to do it just because it is immediately required for all of nation to do so, right? And anyway, you have to mention more about patient prognosis is poor, and there is no alternative treatment here that's suited for the patient. Is that possible to say, or is that possible to provide such a drug, which is not likely to be tested? And yeah, for this reason, right? Okay, I'm going to give you the 5 minutes to prepare for this question. Uh-huh. And then if you're ready, just turn on the microphone here. Mhm.
โอเค Um, as far as I'm concerned,
Mm-hmm.
the doctors should be permitted to treat human subjects with untested drugs when there are no alternative effective treatments and the patient's prognosis is poor. This is because it doing this is the only way to make the patient feel better, even though it may not be 100% effectively, but I think that it is better than doing nothing. However, um, doing this need to let patient know about it, and we should consider patients' decision too, whether they want to receive the treatment or not. Yeah, to respect them as human.
Wait a second แป๊บหนึงครับ
นะครับ
sorry for that เหมือนเสียง interrupt เมื่อกี้นะฮะพี่ลืมปิดไอ้นั้นแน่เลย okay alright again can you repeat your answers to me again just because maybe some interruption here yeah okay
Um, as far as I'm concerned, doctors should be permitted to treat human with untested drugs when there are no alternative effective treatments and the patient's prognosis is poor. The reason is that doing this is better than doing nothing, and it may be the only way to make patient feel better. Even though the drug may not be 100% effective, I think it's better than doing nothing. Yeah. However, we should consider about um, patients' decision too, whether they want to receive whether they want to receive the drug or not,
mm-hmm.
because it is right to show the respect to the patient.
So it means that even there is no alternative treatments, we have to ask the patient to to accept or even admit that the condition of the patient or the disease might be getting poor and poor, right? So it means that anyway, if there is no tested or completely tested drug, so it is possible to use those drugs who are untested too. Is that right?
Yes,
Okay.
absolutely.
So some case scenario from the last pandemic from the COVID-19. So we need to point to use the vaccine. Is that right?
Yes.
Yeah. So basically, I do understand that. So just the vaccine is not likely to, perfectly test it just because it takes time to create or even implementing some vaccine to the humankind. Is that right? But anyway, just only for a COVID-19 outbreak, there is an urgent to use it just because everyone need it, right? So to you, all right. So to you, do you think it is important to test all of drug before using for the patient according to variety of diseases? Yeah. Mhm.
In my opinion, I strongly believe that the drugs only need to test that they are not dangerous or do some toxicity to the patient. If they test and they are sure about that fact, I think they can use it to the patient right away if it is necessary, because the worst outcome
Mhm.
from using that drug will only be that patient don't get better, but they will not get worse. Yeah.
So it means that it is possible, right, for an urgent or something that needs to be done properly. Is that right? Okay, good. So this one is might be like you can say yes or either no, right? Just because for the first question, I can say that either accepting this kind of thing, it might be effective to accepting for untested drug might be effective for some patient who are going to get poor and poorer, right? Just because there is no alternative to. But anyway, in terms of if you strongly say that it is must be tested all the time, so what kind of diseases that we are going to, reconsider from the drug, which must be tested completely for those let's say like diseases or what kind of diseases that you have to do so.
I think that the disease that we should that we should we should use it before testing completely is about the disease that is dangerous to the human life, and
Mm.
it is some kind of some kind of um, contagious disease. Yeah.
So it means infectious diseases, right? For example, like those who can transmit easily, things like that. Is that right? Okay.
Yes.
All right. Good. Thank you so much for your sharing here. So again, right? So you need to see from the concept from the first question is that either you can say yes, and you have to give a reason why. Why do you say like that? For alternative way to say no, so why? It means to the patient that they're going to have like a tested drug here. So it means that for this question, it might be possible in two ways. So just prepare in a different version, right? Okay, so moving to second question here. Should the Thai government provide the same standard of health services to our migrant workers? Migrant worker means that international workers, right? Or those border from neighboring countries, am I correct? And then families, it does to Thai citizens. So for this question, I can say that it's all about like you have to refer to what we did discussion yesterday, right? Like universal treatment or something is standard for all, right? The standard of health services here to all of migrant workers. So to emphasize for this word, I think it is referred to those people living in Thailand and working in Thailand, right? But it's not a citizen of Thai people. Is that right?
Yes.
Yeah. Okay. So do you think it should be the same standard here, right? I'm going to give you for 5 minutes to prepare for this question. And if you're ready, just turn on, right?
Okay. To me, I strongly believe that Thai government should not provide the same standard of health service to all migrant workers as it does to Thai citizens. The reason behind this is that the medical resource in our country is limited. So we should concern about Thai citizens' health first. Um, since since the migrant workers, we are not sure that they will come back to their country um, when the in the future. So we should care about citizens in our country first.
I see. So it means that it is responsible for those staff or medical workers or practitioners that they have to take into consideration that it is all about like a commitment or responsibility to care for Thai citizen as a first come first serve first, right? So based on my experience, I went to maybe a local hospital. It's not that the general hospital or big hospital, let's say like how can I say, healthcare, primary healthcare, right? So I can see that many migrant workers receive some services, especially for the medical equipment or even medical treatment here, right? Lots of migrant workers are queue or even waiting in a queue for receiving that. And it is considered as a little bit burden in terms of like lots of patients combined in the single place at a hospital, right? So do you think it should, provide some treatment to all of them or just let them go to their hometown or even home country?
I think that in that case, we should let them stay until they get treatment, and maybe doctor need to work overtime for a little bit, or in another way, many hospitals usually have doctors in for 24 hours. It's like they will change their shift with other doctors. Yeah. So I think that patient can wait as long as they want in order to get treatment, but when they get treatment, it may be from another doctor from the start. But I think it's okay.
So it's okay to let them get a treatment as much as possible, right? And so we don't have to deny any kind of like objection to them not providing some treatment here, right? Okay, good. So it means that anyway, for this conclusion, for the second question, so you agree to give or provide some facility or even some medical resources, medical treatment, medical prevention to all of the Thai people first, instead of treating other migrant workers here, right? Okay, good. Thank you so much for your sharing here. Good. So for this question, I think for the second question, you have to refer back to the concept of their, their healthcare provider too, right? And then we can generate more ideas. Yeah. Moving to next question here, should doctors be legally required to report cases of suspected child abuse or domesticide, right? Am I correct? Domesticide violence to the police. What is that actually? This one?
It's like the violence in the family, like hitting each other. Yeah.
All right. So again, right? So for this question, I can say that you have to refer The meaning of suspected child abuse, or even like some quarrel, or even some disagreement that happened, or any violence that happened to the family, right? Is that possible for doctors to report to the police here? Okay, right. I'm going to give you 5 minutes, and then if you're ready, you can turn on the microphone.
โอเค From my perspective, doctor shouldn't be legally required to record case of domestic violence to the police. This is because doctor shouldn't make the problem in other family to be more complicated. Yeah, if doctor themselves report the case to the police, it may not solve the problem in their family, but it may produce a long term problem. Yeah, like when Yeah, something like that. So I think that doctor should only encourage the the play of the violence to 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 report to the police by themselves. Yeah, this will make the player have some courage to solve the problem by themselves and not wait for the other to help them.
I see. I do understand that. Okay, right. Thank you so much for sharing here. So for this question, I'm going to say that you have to divide it into two sections. The first one is that the doctors or even medical practitioners' responsibility, right? Just because we're going to have a right, we're going to have a duty to responsible for those kind of like illnesses or even those people who got injury from any cases or things that is maybe unfavorable for those people, right? And also the second part is that we have to understand the case suspected children abuse or even domestic violence here is all about the problems of their own, right? It means that okay, they're gonna have a problem. For example, like they're gonna get an injury, bone fracture, things like that. As a part of doctor, we just deal or even responsible for the treatment. That's it, right? Just because this kind of thing happen and it connects to each other. So the questions try to connect the logical statement here, just because the police have to send such a patient to the doctor, and for the part of doctor have to see what broken or even what damage in their body or any kind of thing, right? And then give a treatment here. But anyway, it seems that the police have to direct to the doctor that what happened to those people, right? And anyway, for this question, it's kind of like you can use effective communication, try to report something true and reliable, but it's not likely to give any opinion for case report or even a suspected children abuse here. From my point of view, I can say that maybe the strategy for dealing with this problem is that the doctors have to understand or even use effective communication to report some cases for police. It's not direct to those scenario or situation that happened there. Yeah, things like that, right? Okay, maybe you can again, right? For your response, I think that is generalized the way that we have to do so. That try to pitch in the try to straightforward in the context. So you can divide into two sections. The first one is that a part of doctor responsibility, and the second one is that a part of how to deal with police with this kind of cases, right? Okay, good. Last section for today is that number 4, right? The last question. Should
Yes.
medically supervised drug injection clinics be established, right, in Thailand, and to provide drug addictions, right, or drug addicts with a safe environment to both inject drug and access to basic medical services? So for the keyword here is that we have to, provide some concept of drug addicts, right? So is that possible to provide or selling some drug in that clinic? I don't think so, right? Okay, I'm going to let you prepare a bit, right? And then if you're ready, you can share it.
To me,
Uh-huh.
I strongly believe that um, that drug injection clinics shouldn't be exist to provide drug addicts with
Uh-huh.
a safe environment. Um, this is because it may be safe to have a clinic like this for the people who have drug addiction. However, in long term, those people who receive a drug from this clinic will
Mm.
still have a problem in their later life. Um, for example, like if they use amphetamine in a
Mm.
safe, although it is used in a safe environment. However, the chemical substance in amphetamine will
Yeah.
keep accumulate in their body and it will
Oh.
be a problem in their later life. Yeah, so doing this will be like do some harm to the patient who have a drug addiction. So I think it shouldn't be done like that.
Mm-hmm.
In my opinion, it they should provide a clinic that help people who have a drug addiction to be able to cancel from the drugs. Yeah. Having a clinic like that will solve the problem from the start point. Yeah.
So it means that you just recommend that for a clinic that provides some drug injection, it should be like rehabilitation for drug addiction instead of provide some facility in a safe environment to those people who drug addicted. Is that right? Okay.
Absolutely.
Yep. Okay, again, I appreciate the way you explain that those people who consider themselves as a drug user, even drug addicted user, right? So they may become or develop the progression of severity in terms of their brain or even behavior later life. Am I correct? All right. So any suggestion to prevent or even limit those kind of use, I can say that those use of drug addicted, especially for illegal drug, for example, you mentioned amphetamine, methamphetamine, or whatever I can say, to reduce in a part of, medical practitioner or even a doctor responsibility here. Any suggestion that you can provide to those people who who have got addicted from the drug and then they develop such like a bad behavior or bad what can happen to them that is might affect to a social right.
In my opinion, I think that before we can help those people who have drug addiction,
Mm-hmm.
um, those people need to realize themselves first that they have a long behavior right now and they are addicted to the drug. Yeah, in this way we we will be able to help them by providing a clinic um,
Mm-hmm.
that will help them be able to not use their drug. Yeah. So I
Mm-hmm.
think that the way we will make people realize whether they are addicted to the drug or not is maybe about making some announcement about
Uh-huh.
about how people with drug addiction behavior do. Yeah, and so that people can check themselves whether they
Mm-hmm.
are addicted or not.
Mm-hmm. But actually, just because I do understand that those people who gonna have a drug addicted, they're gonna live in the big city, especially in Bangkok, right? And then they didn't even expose or even reveal themselves that they are the user of using drug and become addicted here. So it seems to for those people who gonna help them may not know how to treat them properly. Am I correct? Just because they seem to be normal, but they use some kind of thing in their daily lives. So it is hard for doctors or even medical practitioners to supervise them and provide some help to them too, right? So this is a core problem to say something for a drug addicted. I would suggest for the last question is that you can maybe right. I think you can report some cases who, let's say, like the case who gonna get or got drug addicted, right? Especially in the, let's say, teenager or even adult, right? Things like that, and what they can become to be better person, or even what kind of the things that we can prevent from it. So this is the key for the last question here. Anyway, this one, everyone have to say that they just disagree, right? Strongly disagree for this kind of question. But anyway, if we generalize the concept of drug addicted here, it might show like and sharing some information to others too. Nah, all right. So for the last section for today, you have to summarize all of 4 questions here. The first question, second, third, and last question, right? Okay, I'm going to let you prepare a bit.
Okay. For the first question, my opinion is that doctors should be permitted to treat human subjects with untested drug when there are no alternative effective ways and the patient's prognosis is poor. The reason is that doing this is better than doing nothing at all, and it may be the only way to treat patients who are desperate. Yeah, and although it's true that the treatment may not be effective 100%, but it's better than doing nothing and let patient prognosis poor. Yeah. However, we need to consider about patient decision too, whether they want to receive the treatment or not. And for the second question, I strongly believe that Thai government should prioritize Thai citizens first. This is because medical research in our country is limited. So if we treat everyone equally, it may not be enough for people, for some people. Yeah. So and we don't know whether migrant workers will come back to their country or not. So in this way, we should prioritize Thai citizen first, so that we can treat people in our country. For the third question, I I strongly I strongly disagree with the idea that doctors should require to report case of domestic violence to the police, because it will be like to make the problem in their family become more complicated. In we should I think that we should just encourage the victim to 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 let to deal with the problem by themselves. Maybe to report to the police by themselves, so that the victim know how to deal with the situation that they receive violence. Yeah, it's like teaching them more than giving them a hand. Yeah.
Yes. Okay.
And for the last question, I think that medically supervised drug injection clinics shouldn't provide drug addicts with a safe environment to prepare. This is because it's like to do harm to the patient. It may be true that having drug in a safe environment may not do some serious health effect to the patient right now, but in long term, the chemical in drug will keep accumulate in the body, and it will do harm in the later life. So yeah, doing this will be like to make patient die in later life.
I
Yeah.
see.
So I think that the other way to deal with this problem is to make a clinic that help people that help people be able to not use the drug anymore. Yeah, it's like to deal with the problem in the start point. Yeah, and maybe we might make some announcement about how people with drug addiction behave wrongly, so they can always check themselves whether they are addicted or not. Yeah.
I see. All right, good. Thank you so much for sharing such informative information here. So for a constructive feedback for today's class, I think that I appreciate for the ideas or even how connectivity that you can deliver your speaking for those kind of questions in each question properly, right? I would suggest for some constructive feedback in terms of using the word or even vocabulary a bit, all right? For example, like for the first question, you can say, right, if the patient prognosis is getting poor, it might cause a bad behavior or things that dangerous for later life. So it is possible to say something like with the conditional sentence. If you say something from the if x like this and then y like this, okay? So this kind of like it might enhance your grammatical accuracy too, or even some word or word choices or even vocabulary. Just because for speaking is a little bit, we have to say something that they naturally say. For example, it's getting poorer, it's getting better, or even it's getting harder, things like that. Okay, and this is this kind of expression of English here. So for more, I think that it's okay, right? Okay. So for the third question is that again, right? So just because for this question, to me, I just want you to, say something that is basically we can categorize the first one first, doctor responsibility, and then the second is that effective communication, or even like you said, I really appreciate that teaching them instead of giving a hand to them, right? So for this one, if you can connect from the doctor responsibility to the way that we have to use some effective strategy, effective communication here, it might getting better for any kind of solving a problem, right? Things like that, and then try to connect all of idea to the single part, just because you have to conclude and summarize the idea that what you are going to say and explain for more. For any other question, I think that you can cover again, right? Just remind again, just because for discussion part, we can say anything based on the information. But anyway, for effective speaking, you have to start with the introduction and then explain the reason why again, right? Why not? Why not? And then try to conclude or even summarize the idea or standing point that you're going to say. So this is the concept of effective communication here, right? Okay, so all in all, I can say that for you, you develop the way that you speak flow better than yesterday. And also that you can use a range of, word choices. I mean, for the first start, right? Beginning beginning of the sentence that you agree, I would say, to my opinion, to my perspective, or as far as I'm concerned, it's quite good too. But anyway, if you don't want to say something like this, it is possible to say, I think that's it, period, right? Just because for I think, for natural speaking, lots of people can say I think instead of other way too. But anyway, you can switch and change just because we can, use for different phrases or different expression here. Yep. ประมาณนั้นนะครับก็ภาพรวมก็ไม่น่ามีปัญหาแต่ดีขึ้นไหมลอง reflect ตัวเองก่อนมีคำถามไหมฮะวันนี้
ก็คิดว่าอาจจะมีพูดติดขัดบางช่วงบ้างครับ
ไม่เป็นไรเพราะว่ามันเป็นดีคือมันจะมีเหมือนเราสอบ IELTS มันก็จะมี timing ที่เราต้องคิดใช่ไหมครับเราลองย้อนกลับไปตอนที่มันเป็นพาร์ท3 discussion เนี่ยเราไม่สามารถตอบได้ทันทีแต่ว่ามันจะมีแบบ phrase ที่เราต้องเปิดให้เขารู้สึกว่าเนี่ย way ของการคิดของเราอยู่นะครับแต่ว่าภาพรวมก็ flow นะวันนี้ก็คือถือว่าดีคำศัพท์เป็นไงบ้างคำศัพท์ลอง reflect ตัวเองก่อน
คือก็คิดว่าได้หลากหลายมากกว่าเดิมครับ
แต่ว่าคำศัพท์จะเป็นจุดที่ยากสุดนะพี่บอกไว้ก่อนเพราะคือมันต้องเป็น natural speaking บางครั้งพอเราอ่านพี่ก็อ่านหนังสือเยอะเหมือนกันถูกไหมครับเพราะฉะนั้นพอเราใช้คำศัพท์ยากอะไรเงี้ยมันก็อาจจะเป็น way ที่แบบเป็น presentation instead of natural speaking งงไหมหมายถึงว่า let's say ว่าพอเราพูดคำว่าdifferentiate อันนี้มันใช้ได้แต่ว่ามันจะเป็นแนวแบบadvanced ไปหรือกรณีที่เราอาจจะต้องแบบ separate หรือว่า divided อันนี้เป็นคำที่คนเขาเรียกว่า natural speaking ใช้อะไรเงี้ยมันก็ต้องแบบดูทีละบริบททีละ context ทีเนี่ยอันนี้จะเป็นจุดยากคือคำศัพท์หรือ word choices นะฮะgrammar ห่วงไหมหรือว่าไม่เท่าไหร่
ว่าไม่น่าเท่าไหร่ครับ
โอเค grammar ผมไม่ต้อง serious มากเพราะว่าพี่เน้น flow มากกว่าตัว grammar เนี่ยพยายามดึงในเรื่องของ when อย่างเช่น when patient go to hospital they happen what อะไรเงี้ยพยายามคิดเป็น logic นิดหนึ่งหรือว่าแบบ if unless พวกนี้ก็มีการใช้ได้บ้างเพราะว่าถ้าจะดึงแรงก็ต้องพูดประมาณนั้นนะครับแต่ว่าพี่อยากเพิ่มเป็นในส่วนของการเล่าเคสอย่างเช่น according to WHO according to FDA according to World Health blah 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 COVID-19 อะไรพวกนี้เนี่ยมันจะช่วยทำให้แบบ supporting detail ของเราชัดขึ้นมากกว่าที่เราจะใส่แค่ไอเดียของเราเก็ตไหมฮะประมาณนั้นนะโอเคไม่มีอะไรแล้วแหละภาพรวมก็น่าจะพ ร้อมแล้วนะเดี๋ยวรอวีคสุดท้ายนะครับวีคสุดท้ายก็คง cover แล้วก็พี่ก็จะให้เราประเมินว่าแบบเราเป็นยังไงบ้างนะครับแล้วก็พี่ก็จะให้ constructive feedback ทีนึงนะครับโอเคงั้นวันนี้พอแค่นี้ก่อนแล้วกันนะครับ ครับสวัสดีครับบ๊ายบายครับ
ขอบคุณมากครับพี่โดโด